thank you very much. I am, first of all, I'm going to take my coat off, relax a little bit. I want to thank you for organizing this, first of all, and I want to thank everybody here for coming. The fact that you're interested in the U.S. healthcare system is very impressive to me. Might be hard to get this many Americans together to hear about this subject. So it's very impressive. Also, they're not here, but the U.S. State Department and the embassy in Berlin, thank you very much for helping pull this together. This is our third trip to Germany, my fourth or fifth trip here. When I served at Department of Health and Human Services, I was here, I think, at least twice through Germany, very quickly, but through Germany with the cabinet secretary who was very involved in international affairs, World Health Organization, and the like. So we feel very comfortable here. So it's a great, we've been to this area, love this area, and we're really like coming to Germany. I think what I want to do is, first of all, so I've got a presentation, some slides which keep disappearing, but we'll keep them going. Very simple. They just tell a big picture. Feel free to ask a question at any point. Don't let me go on the entire time. But let me start with one thing, and then we'll ask questions. So, because I like this to be as interactive as possible, I find that to be much more helpful for everybody. So, but what I want to do is, in order to understand the healthcare debate in America today, what's going on and where it might go, it is actually fairly important to understand a little bit about history and the history of how we got here. What are the influences? What are the things that really influenced the healthcare system we have, the debate we have, and our politics that are going on right now? So what I want to do is walk through a little bit of that to help. Again, it'll give you a better window. You don't have to agree with any of it, but it'll give you a window into the U.S. that I think will be very helpful then in understanding what we're going to talk about and then understanding as you go forward. And there are three really big impacts that we're going to talk about. Number one is a little bit about our culture, which really drives this issue, but drives all our politics, has a big impact on where we are. Economics, not just the market economics, but some big economic events, some economic situations in the United States that drove our system. And then, of course, our politics. And what about our politics that are how this all comes together? So that's what I want to do, is frame it in those three big categories. Because I think what's probably fairly mysterious, among many things that might be mysterious, is we spend more on healthcare than any other of the developed countries. Yet our health outcomes as a country are not as good as, for instance, Germany. As a population, you are healthier than Americans. But we spend more money than anybody else. However, if you have, and you're able to afford it, that is a key question. But when it comes to things like cancer care, we have the very best care in the world, the best technology, the latest drugs, and the most advanced treatments in the world, and many people come to the United States for this kind of treatment. Not everybody. Again, a lot of it is about money. But still, so it's this great contradiction that we have this system, we have spent all this money, we don't get the results. Why? And I think as other countries look at the United States, it's almost impossible to understand the Western countries in Europe in particular, and Canada and the like. Why don't you have universal health care in the United States? Why don't you somehow cover everybody? And so we're going to talk about that, though we might cover more people than you think, but we'll get to that. So that's what I want to do, help you understand that. That's the conversation we're going to have. First question. How do I do that? Good luck and some smart decision making on my part. I don't know if it's a 50-50 that, but it's those two things. So I was trained to be, I have a master's degree in international security affairs. I was trained to be a Sovietologist. This is the early 1980s. I was going to go into the U.S. State Department. They weren't hiring. They didn't hire me, but I had to go to Washington and get a job. And I just started working. I worked for a member of Congress, Olympia Snowe, in the early 90s. I'd done a couple jobs before then, but for Olympia Snowe. And then in 1993, a job opened up with a member of Congress, and he was the lead Republican in the House when the Clinton health care debate started. That's the interesting thing. So I've had the good fortune to be part of the last 4 major health care debates. We'll talk about that as we go through. So I didn't know a lot about health care back then. I thought it was a very boring subject. I couldn't understand why anybody, our Health and Human Services building in Washington is this very big, ugly building, and I thought, who would want to work in that building? And then I got involved in the issue in 1993 with this huge national debate and was hooked. And I realized it's an issue that touches every single American, just like it does here, all of us. It's at the federal level. I mean, the department touches everybody in some way, shape, or form. And it literally can be life or death. So decisions you make are going to really be involved with people. It's not just big decisions, but something that can affect you around the room. So, and it was very political. So it was fascinating to me, and I learned by the seat of my pants. And so since 1993, that's pretty much all I've done. I've done a few other things since I've left government and work now. But that's basically the answer. Sure. So the first thing I want to do is get the screen back on. So we've got this system, which is a federal state system. So in the U.S., just like our government, our health care is delivered both at the state level as well as the federal level. It's paid for, regulated. It's a dual. We'll talk about that in more depth as we go along. But this is the first thing to know about our culture in the United States, for better or for worse. This is just the reality of who we are. This flag, the Don't Tread on Me flag, is sometimes called the Gadsden Flag after a general in the Army. But this flag has been around longer than we have been a country. This flag was flown before our revolution. Before we had the flag we have today, this was considered almost our national flag. Never officially, but amongst the people it was considered our national flag. It's still relevant today. It is mostly flown by the people who consider themselves part of the Tea Party movement in the United States, a very conservative political movement that's within the Republican Party. It's not a separate party, it's within the Republican Party. And they fly this flag. Why this is important is this sentiment, don't tread on me, could mean don't tell me what to do, and it could be government don't tell me what to do. It could be the state government saying to the federal government, don't tell me what to do. It could be people talking to one another or within a community, not in a rude way, but it is a sentiment that is broad, whether you're Republican or Democrat, very independent thinking, very independent belief of ourselves. And so this is culturally pervades our entire debate. And you'll hear when I talk about this debate, how this rises up throughout the course of the debate and has a very big impact on why we have the health care we have today. So don't tread on me. It's a very important part of who Americans are. Again, for better or for worse, but it's who we are. We just have this attitude. And so again, it's flown, like I said, since before the Revolution. It's actually, I think it's small parts of this, just the rattlesnake, that's a rattlesnake, are actually in some other flag insignia as part of, within the military in terms of some of our various Army, Navy, they have it, small parts of it are included. The other big thing is, so this is the biggest influence. So, okay, I'll keep doing this. Now, so keeping this in mind, there are a couple other big historical things to know about the United States, how we got health insurance as we know it today and understand it today. And the first is this date, 1929. So health insurance as we understand it in America really starts roughly here. And this is what we call prepaid insurance. A doctor in Texas, of all places, Dr. Justin Kimball, who worked at Baylor University, said to the teachers in the town that if you'll pay me, this company I have, our hospital, 50 cents a month, imagine that, we'll cover you in the hospital for 21 days. You can come in and get health care here, and we'll cover for 50 cents a month up to 21 days of health insurance, essentially, in the month. That's the beginning of what health care is today in the United States. It's expanded, it's grown, it's definitely different. But this is what we trace it to. This concept then spread throughout the United States fairly quickly in terms of locations, but not in terms of numbers of people who actually had it. But many places it started popping up all over the United States, particularly the Midwest and the West. It started to pop up, this prepaid insurance idea. So 1929, this is the beginning of what we consider kind of the beginning of health insurance in the United States. So 1935 is roughly the next big date for American development of American health insurance. So up to this point, again, you had these prepaid insurance going on around the country where for very small amounts of money you would get health care coverage. But in around 1935, the Congress passed a law essentially allowing for what we would call tax deductibility of the employer. So the Ford Motor Company at the time, could have paid for health insurance for all their employees and then got a tax deduction when they filled out their federal tax forms. So this is really a very pivotal moment in the United States, because today, about 56% of all health insurance is delivered through and paid for by, not in whole, but in part, employers. Everything from our biggest employers all the way down to small employers of sometimes just 2 and 3 people will be paying for health insurance for their employees, and it's because it's tax deductible. Now, it didn't really take off at this time. It didn't become a big deal at this time. But it shortly did thereafter. In the mid-1940s, when the war was going on, millions of American men are overseas fighting. Our labor market is very tight. So companies were having a hard time attracting employees. So the government declared health insurance to be a fringe benefit. It was a very big activity where they declared it to be a fringe benefit. And we had a wage and price freeze going on, and this is what makes it so important. We were afraid of inflation, particularly after the war we were afraid of inflation, so we froze wages, but the employers wanted to be able to attract good employees. So they didn't have anything to offer. They couldn't offer more salary. They couldn't do much. So what they did do was they offered them this health insurance because it was a fringe benefit which didn't count as a wage or in the wage, and it was deductible. And at this point, this is when it took off. It's in the mid-40s when health insurance took off as a benefit offered by employers. And again, to the point where now it's about 56%. It used to be as high as about 65% of all health insurance offered in the United States went through the employers. It shrunk a little bit. But that's the single biggest way health insurance is delivered in the United States, and therefore access to health care, is because of this. And it wasn't a strategic decision. It wasn't anything well thought out. It was simply a convenience and an incentive. It was convenient, and it was incentivizing for the employers. Matter of fact, the government tried to repeal this tax deductibility after the war was over, and the employers said, no, we like this because we deduct it from our income tax, so we pay less taxes to the federal government. So they didn't want it at all, and it was helpful to them to recruit employees. And today, still to this day, you negotiate your new job or you're hired for a new job, right after what do I get paid is, and what will my health insurance look like? It's a very big deal. So this is a very big, which most people don't know, even in America, and don't really understand. It's almost by accident that we developed the healthcare system we have today. Now, as David said, 1965 is the next big pivotal moment. This is an economic moment and a political moment at the same time. I talked about the 3 big reasons: culture, economics, and politics. So 1965, seniors in America, those 65 and older in America, they don't have any access to health insurance. They're probably retired, so they don't have employer insurance. Unless they have a small business or something, they're retired. And in 1965, as a rule, the 65 and over group, their incomes are much less. Yes, they have Social Security, but still much less. There's no federal pension system. There's no pension systems, generally speaking. There's some, but it's not that big a deal. It hasn't really taken off yet. And so they are one of the biggest reasons for personal bankruptcy in America in 1965 for people over 65 is health care. So Lyndon Baines Johnson, the president at the time, who was implementing a program called the Great Society, an attempt to really lift up create a safety net. You would know that well. Create a safety net, a bigger safety net for Americans of low income and who haven't had the same economic opportunities. Gets Congress to pass Medicare. And so that is it's a federally funded program for everybody over the age of 65. It covers, in 1965, it covers hospital and it covers physician visits. A little bit more, but we can talk about that if you have questions. But that's what happens in 1965. It also, at the same time, he created almost as an afterthought a program called Medicaid, which is a program which only covers, and again, Medicare is purely age, 65 and older. Medicaid is for women and children, their children, and it is income driven. So if you are at the level of poverty in America, and then formally there's a formal definition of what poverty is, there's a number of what poverty is, it goes up almost every year. It's calculated by the government. It's a very well-known thing. So at 100% of poverty and below, if you're a woman or children of a woman who doesn't have, well, that's actually interestingly important because the mother might not the mother might be working, but still the child could qualify. So they're not looked at as a unit. They are individuals sometimes. So Medicaid begins. It's driven by income. The difference between, however, the bigger difference between Medicaid and Medicare is it's a federal and state jointly administered and paid for program. Roughly speaking, 50% of all expenses in Medicaid are paid by the state. So Texas pays its share, New York its share, Wisconsin its share. The federal government pays 50%. And the state runs it. The federal government has broad regulatory authority, but literally the running of the program, determining eligibility, doing all the paperwork is run by the state. Great flexibility. This is where the don't tread on me cultural, that's why. Because the state didn't want the federal government to tell them everything, to make them do everything. They wanted the flexibility to do what they wanted to do with this program while still taking federal money, and so that's why it was created this way. So this is 1965, a huge year. At this point, this is a watershed for seniors in America and for the poor. For the first time, seniors now have this health insurance. It's a watershed moment. It quickly becomes, even though it was very political at the time, our doctors and hospitals didn't want it. They opposed it. Ronald Reagan spoke out against it. It was socialized medicine, all kinds of things. But quickly after its adoption, because seniors signed up, Harry Truman was the first senior to sign up for it, our former president at the time, it became very, very popular, and it is extremely popular today. So the American Medical Association came on board, and they supported it. Our doctors supported it. The American Hospital Association, everybody supported it, because they realized, yep, this might make my job a little bit more difficult, more paperwork, but they realized quickly now they were going to get paid better because now they had people who had insurance as opposed to people who didn't and couldn't pay, but yet they had to treat them. So quickly became very popular. Everybody likes it. The other thing, I mentioned Blue Cross in 1929. In 1965, there's only one entity that can do essentially the paperwork, if you can imagine, the Blue Cross Blue Shield plans across the country are the only ones that had the computer mainframes to actually process all the health insurance claims, the paperwork, to do all that. The federal government didn't have the capacity. So Medicare is a partnership with the private sector who literally does the paperwork the back-end paperwork of Medicare, and has in 1965, did it then, is doing it today. It's still very involved. So the next big moment, so now we have the cultural impacts, we have economics and politics. The next big moment, well, one thing before we get to this. So the next big moment is 1993 when the Clintons, Bill Clinton becomes president. He runs on an idea of universal health care. And so 1993, 94, and early 95, that's the debate in America. Very contentious. I was involved in that, very much so through my boss. Very contentious, very political. Even the Democrats could not support in a majority way the president's ideas. And this is an important part. So we have employer insurance, we have Medicaid, we have Medicare, all existing in 1993. Probably at this point, you're looking at probably somewhere around 80% of the population has health insurance of some kind. So maybe 20% is uninsured, could be a little less, definitely not more. Bill Clinton's idea, however, was to remake the whole thing, all of it. Not just the 20%, the whole thing, all of it. Maybe he was going to leave out Medicaid and Medicare, but he was really going to remake private health insurance in the U.S. That's one thing that's gotten confused with the debate over Obamacare or the Affordable Care Act. Republicans, when that debate was going on, tried to compare it to the Clinton health care debate, and they are not the same. We'll talk more about it, but the Obamacare, Affordable Care Act only was a reform of about 10% of all insurance provided. It was only a reform of about 10%. It was not a remake of the entire healthcare system. The Clinton Care, as it was called, was a remake, and that's why it's failed. It failed because essentially they were making a 100% solution for about a 20% problem. And people just, and again, in America, don't tread on me, we just didn't want it. Nobody wanted it. No, there wasn't any group of people that came together to say this is a really good idea and that we wanted it. However, so that fails in 1995. By 95, it's over. Lots of hard feelings on both sides. However, they still realized there are gaps. There's that 20%. Who are they? By 1997, Senator Ted Kennedy, since passed on, but of the Kennedy family, the Kennedy fame, probably one of America's greatest legislators, got together with a very conservative senator from Utah, Senator Orrin Hatch, and they came up with something called the Children's Health Insurance Program. And this program started to fill a gap. And the gap it filled was, so Medicaid, remember, women, children, but that's 100% of poverty. So this is for children who are above 100% of poverty. Their parents could have insurance through an employer, but that employer insurance doesn't include families. It just includes me, the employee. It doesn't include my family. So they create this program. It is income-based, just like Medicaid, but it's for above 100%. It's just for children to start with. And like Medicaid, it's run by the federal and state government. It's not imposed on states. States must adopt it, just as they had to adopt Medicaid. And so it starts in 97, and by the early 2000s, every state has adopted it. But it took about 5 or 6 years, yes. Right. So below poverty. This is for children above poverty level. So if you used a number, if I just picked the number $15,000 annual income for a family or let's say $20,000 for a family of 2 people, a mother and a child. Let's say that's federal poverty, 100%. So Medicaid is $20,000 and below. CHIP for the child is $20,000 and above. That's how you'd look at it. So this is very, very bipartisan. So again, politics returns is both economic and politics, but it's different politics here. Here it is, we just had this bruising fight. Ted Kennedy really wanted to do something. Orrin Hatch really wanted to do something. So it was very, very bipartisan. There was not a lot of, except from the most extreme conservatives and the most extreme liberals, which is a small amount at the time in the U.S. Congress and Senate, really opposed this for very different reasons, but that was it. So that's the next big one is 1997 when we adopt this program. So at this point, we have now increased. So we are now maybe 85, 86, 87% of the population has health insurance in the United States at this point. This is the next big moment in healthcare in the United States. And this is, so George Bush is president. Obviously, his presidency is shaped by a lot of things, good, bad, and indifferent. This is one of the things when they look back at the presidency of George Bush, there are really two big things he will look back at, the good things. One of them will be this, and one of them will be what he did in Africa in terms of HIV/AIDS, the program he created there. He'll be known for this forever. It will, of course, be tainted and colored by Iraq and Afghanistan. But these are two things. So what this does is, and the reason he's able to pass this is he's this conservative president, yet he's expanding a social welfare safety net program for seniors, which seems a bit odd, and it is. But like, there's a saying in America, Richard Nixon, who was a very strong anti-communist, he opened the door to China. And there's a saying in America, only Nixon could open the door to China because he was such a strong anti-communist. Only he could be trusted to actually open the door to the Chinese and the communists. He's such a strong conservative, only he could increase a safety net program. The Democrats wouldn't be able to do it. No one would trust them. They would think, oh, they'll spend too much money. They'll be whatever. But he was trusted to do it. Again, American politics oftentimes confusing and contradictory. Classic example. So what this program did was it didn't fundamentally change Medicare as we know it. It did two big things. So 1965, as I mentioned, hospitals and doctors are covered. No drugs. There is a way seniors could get drugs in Medicare. It was a private option. It was expensive, and not all seniors did it. So there was a huge chunk of American seniors who essentially could only afford drugs or get drug benefit or buy their prescriptions out of their own pocket. So, created something called, our program we divided into 4 parts. It's called Part A, which is hospitals, and there's a dedicated tax to Part A. All of us as Americans pay Medicare tax, Part A. Part B is the physician care I mentioned, paid out of the general treasury. They created Part D, which is just a standalone drug benefit. So if you're a senior, A and B, and you want drug coverage, you bought Part D, and it was just for drugs. Federal government regulated kind of what that package would look like, but it didn't prescribe it exactly. So in America, in Part D, it's all 50 states. It's literally offered by state. There might be 3,000 different choices you could make as an American senior. Now, not in every state. In California, there maybe is 50. In Virginia, there might be 25. In Texas, there might be 13. In New York, there could be 65 choices. But in total, it's probably around 2,500 to 3,000 different choices. The other big the other big program created is something called Part C, which is we call Medicare Advantage. And it is health insurance that looks like what people who are under 65 and have employer insurance, it's what it looks like. So it combines A and B and D together. That's C. It's in one package. So if you're a senior and you choose Part C, you get your hospital coverage, you get your physician coverage, you get your drugs, you probably get dental, you might get some vision care. Under 65, it's what we call managed care in America. That's what it looks like. It's one form. You don't get a lot of forms. It's simpler. It's easier. And so it's a trend that's growing. I think we're at about 35% of all seniors have Part C. In 10 years, it'll probably be 50%. In another 10 years, it could be 75%. And the reason is because people who are under 65 now and age in, this is the health care they're familiar with. They're not familiar with choosing 3 separate parts. They're choosing one thing. So this is it's a very political debate, oddly political. Ted Kennedy, once again, is a huge supporter of this program and helped bring it through the Senate, and it passed the Senate overwhelmingly. In the House of Representatives, the politics at the time, the House was becoming more conservative than the Senate, much more conservative. And so most of the argument was about cost. They just didn't want to pay for it. They felt it was too expensive. There weren't any corresponding cost offsets. You weren't dedicating a tax. The Republicans wouldn't do that. But they say there's no revenue support this. It just comes out of the general treasury, which means we as Americans are going to pay for it directly. It's going to raise our deficit. It's going to raise the debt. They didn't like it. It passed by one vote in the end. I could tell you the story of that night. Very long night, very interesting politics. But it passed by one vote, and it passed. Like the original Medicaid, or Medicare and Medicaid, however, it quickly became very popular. And the reason was quite simple. With access to these pharmaceuticals now, they didn't have to worry, can I afford this? Can I take this medicine? They now took their medicines. They now filled their prescriptions. And all of a sudden, the health of seniors started to go up. So seniors now, if they were diabetic, they could consistently get their diabetes medicine and be treated, and we started to see fewer hospitalizations. We started to see fewer doctor visits. It worked. While expensive, far less expensive than anybody estimated. Much less expensive. Billions and billions of dollars less expensive per year than anybody anticipated. Still expensive because it's new, and the quality of the health of the seniors was going up. They were accessing medicines. Now, 99% of all seniors have access to a drug benefit. The only ones who don't are extraordinarily wealthy, who just pay for it out of their own pockets. That's who doesn't do it. So, huge controversy at the time. Turns out to be very popular, and nobody is going to take it away from seniors, that's for sure. This is the way I described it. Hospital care is A, dedicated tax. Physician care, B, general treasury. This Medicare Advantage, this thing that it brings it all together, is not a dedicated out of the general treasury. D, benefits only out of the general treasury. That's what our program looks like today. It's offered in all 50 states. It's run completely by the federal government. Okay, so that brings us to Obamacare as you know it. We'll call it that since we are at the Obama Institute. Interestingly enough, at the time, that was used as a term of derision. It was meant to be derogatory and politically damaging that Republicans coined. They took it after the Clinton care, because that's what Clinton care was called. When they were fighting the Clinton battle, it was called Clinton care. This is called Obamacare. It probably, and because of this, there's a very odd, and we'll talk about this in a second. So in 2008, there's a sentiment growing in the United States. We have this gap. We're down to about 15% of the public does not have health insurance. Now, a different part of this issue is a fairly good chunk of that who doesn't have health insurance are undocumented immigrants. So not documented immigrants, so not immigrants who are in the country legally, have green cards, paperwork, whatever it is, they're all eligible for all our health programs. It's people who are here with no documentation, none whatsoever. That's a big chunk, and it's a different chunk, not really going to address that because it's a very different problem. But we're down to about 15% of the eligible population for any kind of health insurance who don't have health insurance. And this is what Obamacare addresses. Not the whole system, not my health insurance at APCO, not the federal employee insurance, not Ford's insurance, Ford Motor Company. It's this 15% who are essentially individual people, a small business of less than 10 who don't have health insurance because it's too expensive. That's what this focus is about. It's not anything more than that. And the premise is extremely simple. And the premise is very Republican. That's the funny part. So in 2000, take you back to 1995, the Republicans put an alternative up to the Clinton care. My boss helped craft the Republican alternative to Clinton care. What did it look like? It developed a marketplace. So all it really was an online marketplace, even in 1995, as a simple place for everybody to go and buy health insurance. Just like your Christmas markets, just like any other market, a grocery store, a mall, anything. It's just a place to go and buy health insurance. Because before 2009, this passes, the individual has to go out and search. You have to go out and look. You have to go to an insurance broker. What do they have? You have to go to this insurance broker because maybe they offer 3 choices. These guys have 5. And it's very unregulated. The insurance generally isn't very good unless you're wealthy. It might not cover much. It's not very good. It's not a good place to buy health insurance. So that's the number one thing it does. This is in 1993. It provides a premium subsidy to people based on income, purely based on income, realizing that if your issue of buying health insurance is you cannot afford it, we have to give you an ability to afford it. So it includes that. And then it includes something called the individual mandate, which, if you know anything about health insurance, quickly, in health insurance in particular, but it's the same theory for house insurance, car insurance, any kind of insurance. But very quickly, if you're going to do health insurance, you need to balance this third of the room who are very healthy young people, generally speaking, and don't use much health insurance, with this middle section of the room who have used some health insurance. You get all your vaccinations if you have a family and your kids. You get a little sicker, but you don't have any really chronic diseases. You don't have a lot of diabetes. Maybe 3 out of that 100 do. So you're moderately healthy, but you still have a few things. And over here, this group, less than a third, perhaps, these people have multiple chronic diseases. They might have asthma, and they might have diabetes, and they might have some lower back pain, and they're the ones who are getting more cancers over here. So they're expensive because they consume a lot of health care, not because they want to. They consume it because they have to. So in health insurance, you need a very big pool of all these people combined that has balance between the 3 different groups. The big group is going to be the middle. This middle group is going to be the biggest. But you still want lots of these healthy young people because eventually they're going to move to this group. This group's going to move to this group. And then this group moves on. They age, obviously pass away. That's the idea behind health insurance. It's a really important concept. And that's, again, when you are in a market like the United States, it's a very, very important thing to do. And so that's what the Republican plan in 1993 looks like. The Obamacare is the exact same plan. Exact same plan. It was not it wasn't random that it happened this way. They specifically picked it because they thought this will attract Republican support. But it didn't because of politics. But the economics were all right. They're going after about 10 to 15% of the 10% of the market that's left. That's not uninsured, but that is this individual market is about 10%. What are we going to do? We're going to use this market, what we would call market principles. Simple, just leveraging the private sector, the private health insurance companies, the hospitals, the doctors to provide this health insurance. We'll subsidize. We'll create this big pool. You'd think that would pass overwhelmingly, but of course it doesn't. It's all about politics. And a reason it's about politics is because there was a group of Republicans for very many ideas. Republicans are not just one thing in America. There are at least 4 or 5. We have 2 parties in America, but like Germany, where you have multiple parties, we have multiple parties within the single party. So in Republicans, there are 4 or 5 different kind of Republicans. Democrats, same thing. There are 3 or 4 different kinds of Democrats. So because of all these politics that are going on, there are some people who just are always going to oppose a Democrat. Always. Doesn't matter. There's some people who just really, really don't like Barack Obama. They don't like him. There are some who came to Congress who are going to shake it all up, no matter what. And they just oppose him because they're shaking it up. Whatever it is, they don't. It's not the idea. It's just that I'm here to rattle the tree. I don't care. And that's what they're going to do. So, and there are some people who policy grounds just said it's too expensive, it is complicated. Now, the difference between Obamacare in 2009 and the Republicans in 1993 is Obamacare is far more complicated than what we proposed. Far more complicated than that. And that is where, personally, I would have a difference with it. I like Obamacare structurally. From a policy perspective, I like it. It's far too complicated. It could be simpler. easier to use, less regulation, far less paperwork. That's where I come from. I'm a practical guy. I think practical. But in essence, it is a Republican plan. But the politics of it are what did it. And because of all the politics, the bill only passed with all Democrat support. And that's why there's such a problem today. You cannot, in America, you cannot pass legislation like this, that's this big. You can't pass legislation like that. CHIP didn't pass like that, the Children's Health Insurance Program. The Medicare modernization didn't pass like that. Medicare and Medicaid originally didn't pass like that. Social Security Act didn't pass like that in America. They were bipartisan. They did have bipartisan support. Perhaps there was a very vigorous debate, but the votes were bipartisan. This had no Republican votes, and therefore didn't doom it, it passed. But it made it contentious and will make it contentious for years to come. So, again, all of this are shaped by our culture. Don't tell me what to do. And me could be the state, the individual. It could be anybody, but it's just this attitude. Economics, 1935, we have to figure out a way to allow employers to attract more employees. We make health insurance deductible, and we make it a fringe benefit. 1965, yep, we do want to help seniors, but really it has a lot to do with economics too, i.e. they're getting hit hard in their wallets by health costs, so we'll create this program for them. Same thing then happens in, again, Bill Clinton's attempt failed, but so all of these have all these elements in them of politics, economics, and our culture help to shape it. And again, whether you think that makes sense, that's a different question. But that is what drives in America our politics. That is what drove our healthcare debate. It's why we have the healthcare system today. It's not that we are now down to, thanks to Obamacare, we are at the lowest point of uninsured in America ever. 8%. 8% of Americans don't have health insurance. Again, here that might seem like unimaginable. But in America, that is extraordinarily good. And the other thing that Obamacare did was, besides this individual market, it took the Medicaid program. And remember earlier your question, 100% of poverty? Well, now it expanded it to 137% of poverty. But like Medicaid itself, it has to be adopted by each and every state. And only, I think it's 34 out of 50 states have adopted the expansion. But that has meant an extra, it's like 12 to 14 million people have health insurance through Medicare. So you have 10 million in this individual marketplace. You have about 10, 12, 13 million in Medicaid. Altogether, you've got around 22, 23 million people who in 2017 have health insurance who did not have health insurance. Well, I don't want to say did not have health insurance, but who clearly didn't have health insurance this good, that's for sure. And all those Medicaid people are brand new. Everybody in Medicaid is brand new. It's the individual market, the 10 million, couple million aren't brand new. They had it previously, but it wasn't very good. Now they have better health insurance. And better health insurance means one thing: access to health care, and that's ultimately what's important. Is my ability now to go see my doctor to get treated for my diabetes, my lower back pain, my asthma, to get cancer care easily without a worry. I don't have to worry about paying for it. I don't have to worry about what'll they think of me if I go in there without insurance. Any of that is gone for this whole group. And we've done studies on this, and people are using health insurance, this new health insurance, to a great deal in America. And that's a very, very good thing. And that's ultimately where we end up. So the Republicans say we're going to repeal it. Go ahead. Mm-hmm.
And in those states that didn't expand,
Mm-hmm.
as I understand it, this gap between 100, if you're below 100%, you get covered.
Right.
By Medicaid. If you're like at 126%, you don't get covered by Medicaid. You also don't get the funding through
Correct.
Obamacare.
Yes. There are many nuances to this that are complicated, but that's one of the big areas is why they did the Medicaid expansion, was because they wanted they figured originally it was mandatory that all states expand. The court got involved, the Supreme Court got involved and said you can't do that based on U.S. law. So it had to be voluntary, hence it was voluntary. But the original idea was everybody who's eligible for Medicaid up to 130% will get them in, and then above that we'll cover them in this individual market. But there is a gap. There are people who are too rich, in some states, too rich for Medicaid, but not poor enough, or too rich for Medicaid, but don't qualify for a premium subsidy or qualify to join this individual marketplace. So there still is a group of people. We're not there yet. If Obamacare would have worked perfectly, it might have captured. We might be down to 3 or 4% uninsured, maybe, if it worked perfectly. But for a bunch of reasons, this included, it didn't work perfectly. And so we still have this 8%. So there might be 4 or 5% that we still could capture ultimately if we could get the whole thing to work the way it was originally designed.
The question that comes from that is, as I understand it, only Republican states didn't.
No, not true. Many Republican states, matter of fact, yeah, I think it's 12 Republican states expanded Medicaid. Because again, only 12 states. Of the states who didn't, yes, they're all Republican states. And they did it almost exclusively, two things. One, again, they're probably a Republican governor and controlled legislatures by the Republicans. So they just fundamentally politically rejected it and said no. Not for any reason other than politics. We don't like this guy. We're not doing it. Some of them rejected it due to money. They were, even though the program as set up would pay 100% of your expanded costs for the first, I think, 4 years, and then 90% after that. And then it slowly decreased, I think, down to 80%, around there. Still a very, very good deal. But they still said, we don't trust the federal government. Hence, don't tread on me. We don't trust the federal government to stick with this plan. So we're not going to do it. Mostly driven by politics. Really, they would often use the financial argument, but really it was politics. And again, for the Republican governors who did expand, it was done for the exact opposite reasons. They said, this is the best thing for the people in this state, whether it doesn't matter, Republican or Democrat, it's the best thing for these people. And we do trust the federal government to pay. So they just went the opposite direction. So we have this gap, like I said, about 8% now. 4 or 5% of that, if Obamacare worked perfectly, could. But we're always going to have, there's always going to be a gap, a small gap, where we're going to have uninsured people, very, very wealthy people, undocumented immigrants, and just true people who they won't join any federal program. They don't, any state program, they will, these are people who are living out in the woods, as we call them, off the grid. They're not connected to the rest of their societies. That's always going to exist in America. Again, always going to exist. And there's nothing we can do about that at the end of the day. So that's why we have the debate we have now. So the Republicans said, we're going to repeal because it's wrong all the way, and for very many reasons, depending on which Republican you asked. And then they figured out once all of a sudden this program started to work and people started to sign up, and there were 22 million people benefiting from this who were getting health care, that's important, they realized we have to have a plan to replace it. We can't just repeal it and take it away from people. We have to have a plan to replace it. So they came up with some plans. We have something in Congress called the Congressional Budget Office, which essentially analyzes any major piece of legislation which spends money. You probably have something similar. And this Congressional Budget Office, analyzing these plans, said, you're going to reduce the deficit. Yep. That was a big thing for Republicans. But, oh, by the way, depending on exactly what plan you're looking at, anywhere from 20 to 32 million people were going to lose their health insurance. So people were going to lose their health insurance who had it now, but not due to the expansion of Medicaid. They were simply going to lose it because the plans for Medicaid were such that it was going to actually shrink even old covered populations. And and at the end of the day, yes, the individual senators particularly voted a certain way. We can talk about that. But at the end of the day, that's why it succeeded. And these people were vocal, but also the congressmen and the senators, they just knew this, and they couldn't take it away from these people. They couldn't do it. Some of them gleefully said sure, but in the House it passed by one vote, and in the Senate, as we know, they tried 3 times, voted once, and it failed by one vote in the Senate. So if you read anything about that, one senator in particular got a lot of notoriety, Senator John McCain. We can talk about that. But it failed by one vote, and that was it. So the likelihood that it's going to come back is declining tremendously. I don't expect it will. We can talk about why it won't, but it won't. Even Republicans now, as we speak, in the last week, are admitting that they think the ACA is here to stay. But there's lots of ways this administration cannot support it. There's ways they can undermine this law, and they're going to try. I guarantee it, they're going to try. But again, at the end of the day, here's an interesting thing. If you look at the map in the United States, where our elections, of course, are by state, you look at the map of Donald Trump's victory, and you will see huge throughout the South of America and in the South, the Midwest, some parts of the Southwest, a little bit of what we call our industrial North, Pennsylvania, Ohio, all red. If you then take a map of the people who benefit from the Affordable Care Act, particularly those who receive a premium, about 85% of those who are in the program get a premium subsidy. So they get some financial support to pay for those premiums. And some people are paying as little as $5, $10, $15, $20 a month. That's all they pay out of their pocket for a premium. There's another support program which provides help for what we call copays, deductibles, things like this, other things that you have to pay. That's about 60%. When you take the map of the people who benefit the most, lay it on top of the electoral map of Donald Trump, it's almost identical. His people benefit the most. And here's the thing. Remember Obamacare? So it's called Obamacare. So you talk to those people, and they say, you need to get rid of Obamacare. It's awful. But then you talk to them about their health insurance that they just got. And they say, oh, no. I don't mean this health insurance. I mean that Obamacare stuff. That's what you got to get rid of. Like this. In Medicare, interestingly enough, so this is a completely federally run program, federally paid for. Yes, it is administered by and partnered with the private sector. So if you are in Florida, this is particularly a true thing in Florida, if you're in Florida and you are on Medicare, your forms you'll get, the things that will tell you, we paid for all this, this is the service you got, this is what we paid for, and you might owe $25. It'll say Medicare, but somewhere on there will be the contractor's logo. So Blue Cross Blue Shield of Florida, perhaps, will be on there because they've done the paperwork. They've processed all this paperwork. They actually are involved in some of decision making. So you talk to seniors, particularly in Florida, and they'll say, you keep your hands off my Blue Cross Blue Shield Medicare. Disconnect that it's a federal program. They don't, it's their health care program. It's my health care program, not Obamacare. Again, hard to understand. It is just because it goes back to the cultural impacts of the way Americans think. It's my health care now, mine. So I'm going to stop there and let's have questions and chat.